Sisters show. I am so excited to have our guest. We have Jackie Rodriguez. She is a no longer a pediatric speech language pathologist, so we'll actually be getting into that. But she is a speech language pathologist. She's here to teach us a bit about bilingualism across the lifespan. Jackie, I'm gonna read your bio for you, and then just please let me know anything that I might miss. Okay.
Okay.
So, Jackie Rodriguez is a speech pathologist who specializes in ethical assessment and treatment of culturally and linguistically diverse populations across the lifespan. She is L1 English and L2 Spanish speaker. Jackie received her Bachelor's of Science in Communication Sciences and Disorders, as well as a Bachelor of Arts in Spanish from the University of Georgia. She received her Master's of Science in Communication Sciences and Disorders from Georgia State University. She has experience working in bilingual pediatric diagnostics, as well as in skilled nursing, assisted living, and outpatient adult medical settings. Jackie's multicultural background has informed her practice and passion for encouraging speech pathologists to learn and use their heritage language in their practice. Jackie, is there anything that I missed in that fabulous biography of yours?
No, not really. I think just kind of to add what you mentioned. So I started out as a pediatric SLP, and now I'm working full time PRN, meaning I have a bunch of different as needed jobs, and I struggle to kind of make that work every week.
Ooh, yeah, I mean, I would love to know how you toggle between just really going back and forth between pediatrics and geriatrics. How does that
Yeah.
work?
So, I think the most important thing is just staying abreast of the research. Even when I spent my first 3 years working as a pediatric speech pathologist. And when I graduated from grad school, I knew that I had interest in working on the medical side of things. So, when I would go to ASHA or my state convention or any sort of speech pathology convention that wasn't specific to a certain population, I would make sure to take a variety of courses so that I could stay abreast of the ever changing research in dysphagia as well as the changing research in pediatrics. Like for example, just what there's been, I feel like over just the past year and a half, there's been a huge shift in what we know about Gestalt language processing. So that's been something that I'm trying to stay abreast of on the pediatric side. Yeah.
I really appreciate the science and the fact that you even mentioned Gestalt. I know before we went live, you were talking about how you are about to have research in dementia. But before we get into all of that, can you tell us a bit about your why? What is your reason for joining the profession and what makes you keep going now?
So originally I wanted to be a physical therapist. My mom has rheumatoid arthritis. She's had it since I was basically an infant. And if you're not really familiar with rheumatoid arthritis, it's an autoimmune disease. It's similar to lupus, whereas it causes inflammation in the joints. And so I have always, even though my mom was diagnosed in her mid 30s. I have never known my mom without a disability. So I wanted to go into a helping career because I watched as she has gone to physical and occupational therapy over the years. And to be quite honest, I found physical therapy kind of boring. It just wasn't really my thing. And I saw a documentary called Here and Now. It was about a woman whose parents were they were probably like in their 50s or 60s, and they underwent cochlear implantation. And it was about their journey from the deaf world into the hearing world. And they worked with an audiologist, and they might have worked with a speech pathologist. But after seeing that documentary, I was really interested in the field, and that's kind of how I learned more about speech. And I think my why do I continue to stay in this field and keep going is there's just a broad amount of things that we can do with our skills. We're highly specialized, but also
Mhm.
still we have a broad range of knowledge. So I enjoy the flexibility and getting to bounce around in different settings and feel like I'm doing a bunch of different jobs, but it's all under that broad umbrella of speech language pathology.
Well, I appreciate, thank you for letting us know your why. And I just want to circle back to something that I'm just so interested about the fact that you are now pivoting a bit over to the dementia realm. And so, can you tell us a little bit about really even how bilingualism works when it comes to dementia patients?
Yeah, so I started transitioning to the medical side. Oh, in 2020, like literally at the worst time. I during that time I started as a travel speech pathologist, and I took my very first assignment in a pediatric occupational therapy clinic, so that I was doing something similar to what I've already done while transitioning into the travel world. And then I took a plunge into sniffs literally in March of 2020. So that was a super intense time. But from there, I had about 10 travel assignments, primarily in skilled nursing or continuing care retirement communities, which are communities that have skilled nursing, assisted living, and memory care. And now that I'm back in Georgia, which is my home state, my PRN jobs are primarily serving adult populations. I'm working in a inpatient rehab hospital, and a couple of assisted livings, and also SNF. And so my passion for dementia care has really, really grown, because that's a majority of the population that I see. And I think just more broadly across the adult side, there is really a need for bilingual SLPs. That the majority of our bilingual SLPs are pediatric SLPs. If you look at the research that comes out of the field of speech language pathology, it's almost all about bilingual language acquisition, and there's not much on the opposite side with acquired disabilities. And with dementia, one thing that I see a lot is as speech pathologists, if you're not familiar with what our role is in dementia care, we can help caregivers and staff and family members communicate with their person with dementia. And we also can play a really important role in staging dementia, and then providing cognitively appropriate skills for the person to participate in on a daily basis to help improve their quality of life, to help decrease anxiety due to confusion, to help improve caregiver quality of life. So, some helping caregivers combat some of the problems and issues that we see with behaviors that are associated with dementia. And particularly, to answer your question, with our bilingual people with dementia, one thing that we start to see is, with all people with dementia, as dementia progresses, we see language loss. And we know that your long term memory tends to be intact more than short term memory. And so, oftentimes, if you have learned a second language later in your life, sometimes what we'll see is our patients with dementia revert back to their primary language, or they might begin to have unequal language skills in their different languages, and they might have trouble modulating between those two languages. So sometimes we'll have, let's say, a native Spanish speaker who learned English for work later in life. They might get to a point where now they're having some trouble with comprehension, but their Spanish comprehension is most intact. So, what that might look like is, if there's staff available that's bilingual, pairing bilingual staff with that person with dementia. Sometimes it's giving the person with dementia direct cues if they're able to still code switch, and cueing to help them have more awareness. Sometimes it might be providing alternate means of communication, so giving them like a communication board. So that's a huge thing that I see with my patients with dementia. And then on the swallowing side, we also see that people with dementia have changes in their swallow. So you experience different sensory changes that might impact your eating and your feeding habits. And then just your attention to a meal can also cause unsafe swallowing habits, which could cause dysphagia that might not truly be attributed to something physiological, but it's more attributed to your poor cognition. And so, with our bilingual patients, another thing that I've seen too, especially in long term care, is that sometimes the diet of the facility does not match the cultural diet of our patient. So sometimes that might even look like doing some brainstorming and talking with the kitchen staff about food items that we can incorporate that are more consistent with the patient's diet, or even having family members bring spices that we could add to the food that makes it taste more like their diet that they're accustomed to. And there's just a huge need for more SLPs that have that kind of knowledge to bridge that gap in service provision for people who have dementia.
And that's excellent, Jackie. I especially like how you mentioned dysphagia when it comes to to the bilingual population, and exactly how we can really serve them during that stage and during that challenge of their life. I
Mhm.
want to do a quick audience highlight. We have Ari Burgoyne, and she is an aspiring speech pathologist. She actually graduates in December. Uh,
Woohoo!
Yay, girl! She said her parents told her that she should become a travel SLP. I know a couple things. I'm thankful that she is here if she's still on. One, she's in California, so I know we were just saying how there's a big need for travel speech pathologists out there. And
Mhm.
also, she is aspiring bilingual. So she just came from the Dominican Republic, and
Oh.
I know she is continuing to study Spanish so she could become a bilingual SLP herself. So I hope that anyone listening to this, especially even if you are already a speech pathologist, get the training you need to become a bilingual SLP. What would you say about that, Jackie? Just as far as what we can do as speech pathologists in the profession to meet those needs for our patients who are bilingual.
Yeah, so I I always hear monolingual SLPs. Well, I don't even want to say it's monolingual SLPs. I think a big just misconception in this field in general, I hear a lot of bilingual SLPs say this as well, is you'll always see a post on Facebook or on social media and someone saying, I have a bilingual kid, like I don't know where to start with my assessment. What can I do to help this child? And you'll see a million comments that say, you need to consult with a bilingual SLP. Why hasn't a bilingual SLP treated this child? But if you look at the statistics, less than 8% of us are bilingual SLPs. And another thing to note is that the way that ASHA tracks bilingual SLPs is it's self reported. And to be quite frank, sometimes we have non native speakers who are also not of the culture of the language that they speak, who graduate from school and maybe have a degree in Spanish. And even though they might have a lot of like grammatical knowledge of the language, don't necessarily have the conversational skills to be able to call themselves a speech language pathologist and don't have the cultural knowledge. And so sometimes some of these self reported bilingual SLPs are people that meet that demographic. So my point being here is that we just don't have the staff in this country to be able to say, oh, every time there's a bilingual assessment, why haven't you referred to a bilingual SLP? Just refer out, send this kid somewhere else, when it that's just not the reality in many places. So it's everybody's responsibility to be studying these the population that they're working with and learning about second language acquisition and bilingualism. And even if you don't speak another language, there's so many things that you can educate yourself about to help better prepare yourself to work with bilingual populations. So that might look like, one, just familiarizing yourself with the countries that the bilingual children that you're working with are coming from, because we all know that the Puerto Rican dialect is a lot different from the Mexican dialect, is a lot different from the Argentine dialect. So just starting with familiarizing yourself with these different countries, and getting an idea of what the Spanish dialect looks like, then that's a great starting point. And then from there, familiarizing yourself with Spanish influenced English and knowing what some of these general features or grammatical differences or phonetic differences look like in English. And then um, so when I worked in the schools, I got ESOL endorsed, and I learned so much about second language acquisition, and that's a great thing that you can do, especially if you're not a bilingual SLP yourself. So, just like how if you have a caseload and you're noticing you're getting a ton of kids with apraxia and you don't know a lot about apraxia, you're going to start taking courses about apraxia, right? The same thing applies to culture, that you learn as much as you can and also work on checking your own biases and seeing how that's influencing your work and the way that you approach the people that you treat.
And thank you so much. I want to really highlight you a little bit and your own cultural background. And how has your own cultural background contributed to this passion that you have for the bilingual populations?
Yeah, so my mom is African American. My dad is Afro Puerto Rican. And I think growing up, my language skills were always so policed by others.
Mm.
So, on one hand, I was always told that I talk like a white girl, that I don't talk like a black person because I don't use African American English. And then on the other hand, I'm not a native Spanish speaker. I learned it in school. And I was always told that, well, you're not really Puerto Rican, you don't speak Spanish. And just seeing, feeling um, discriminated against because of my language skills or lack of language skills. And then once I joined this profession and I got more of an understanding of some of these terms like code switching and how people have been forced to code switch or to lose their languages because of discrimination, whether it's racial discrimination or in the case of Latinos, linguistic prejudice, and feeling very empowered in that it doesn't matter. Like now I'm an expert and you can't argue with me and tell me who I am because of my language skills, because I will school you on
Yep.
African
Yeah.
American English and school you on Spanish. And so I think that in a way, my what I have learned in this career has intertwined with my own personal identity and helped me to feel more empowered in my language skills. And so I learned Spanish in school primarily. And then, like I said, when I really started working in the schools and seeing from adult eyes how so many of these children who come from homes where mom and dad might not even speak English, and then seeing how their Spanish skills are so underdeveloped because it's not being affirmed in the classroom or reinforced in the classroom, I didn't feel so bad about not being a native about not being a native Spanish speaker. And
Mhm.
then learning more ways that I could ethically use my Spanish skills as a speech language pathologist. So sometimes what that might look like is sometimes there are dialects that are really hard for me to understand. And I'm like, okay, I'm going to grab an interpreter and that's okay. Or sometimes there are some skills that I don't really feel comfortable treating. And so that's, my opportunity to say, okay, ethically, this is not something that I can do right now. And I think a lot of bilingual SLPs feel similarly. You have some non native English speakers who might not feel comfortable teaching certain phonemes because they struggle with producing them in English. And there's nothing wrong with that. Just like how when we sometimes we don't feel very comfortable treating certain disorders because we don't have a ton of experience with that. It's okay to refer out. So just my own background and then seeing how how this is a very English only country, has really helped me to feel empowered and to help advocate for the way we approach bilingualism and also for our expectations for our bilingual SLPs, especially those that come from the culture of the language that they speak. So.
Thank you for that input and also just adding grace because I consider myself a bilingual SLP. But even myself, I'm still learning. I'm still learning a lot about the language. And, same thing when there's people from different dialects. For example, Puerto Rican, very beautiful dialect. Also, I'm still struggling to understand it. Yes, no, definitely grabbing an interpreter, and I always say, "Español no es mi lenguaje maternal." Is not my native language, so please give me grace. So thank you so much, Jackie, for that. I think that's what I needed to hear. So I want to go over into health literacy, and could you just give us a brief overview of what is health literacy exactly, and how does that play a role in effective intervention for these patients?
Yeah, so health literacy is the way that specific aspects of our lives influence the way that we're able to understand our body and our health. So there are different things that we refer to as social determinants of health, and these social determinants of health help contribute to the way that we're able to understand our body and our healthcare. And so when we look specifically at speech language pathology, they help us to understand um, our swallow mechanism and how that's might be impaired, our cognition, and how our brain works to understand things, and our communication and how it develops, especially when we're looking at children. So, some social determinants of health include your education and your literacy. So, are you able to read handouts and materials and other educational materials that are provided to you from a provider? Your language. So, do you have access to healthcare in a language that you understand? Your socioeconomic background. So, um, the amount of money you have, and do you have money to pay for insurance, or do you use health insurance that's provided from the government? Do you have financial means to pay for private therapy in addition to publicly funded therapy? Um, our community structure and built community structure. So we look at certain communities do not have hospitals, or hospitals are being shut down. Certain communities don't have good quality groceries, and people rely on food from corner stores, and as a result are at a greater risk of stroke, diabetes, things that can cause communication disorders or swallowing disorders. So and health literacy is very important. It's important to how our people that we work with make or do not make progress in therapy. And I think that a lot of SLPs don't have a really good understanding of that.
So then what would you say how we can incorporate health literacy into our interventions to make sure that we can prevent these events from happening?
So I think it starts with taking continuing education and reading the literature on health literacy first so that you have a really good understanding of it. Second, understanding the population that you work with. So a lot of times people or a lot of times SLPs work in one community and live in a separate community. So just having an understanding of how do your clients get to you every day? Do they take the bus, or do they rely on public transportation? Do they rely on those Medicaid and Medicare buses that are, notoriously late? Um, do they have a car? Can they drive to you? What kind of resources do they have for other therapies or for some of the things that you're recommending? So, do they have access to funds to be able to purchase an AAC device? Do they have access to the internet to even be able to, if you're recommending apps or videos to watch or websites to use, do they have access to that? And then reshaping your bias. Again, I think I've mentioned it a couple of times that just One thing that I see a lot as a medical speech pathologist, with our Black population. So you look at Black communities in the United States. Many of them are formerly redlined communities. Now, we don't have the time to really get into that, but that is a great topic to look up on your own time, redlining, and how it has contributed to the structure of the United States today, and how a lot of times in Black communities, because of redlining, there are businesses that don't open there. So you don't have accessibility to good quality grocery stores, or even the food that is brought to the grocery stores in those communities might not be very healthy foods. And then what ends up happening is, like I just mentioned earlier, relying on corner stores or not having access to healthy fruits and vegetables. And then you work in hospitals that have large Black communities, and you're noticing, oh, there so many of my patients have diabetes. And the quick and easy way to approach this is, oh, well, it's cultural diet, or, oh, well, people just don't eat well enough, or they're lazy. But when you take a step back and you look at some of these structural and systemic issues that contribute to healthy foods, it's deeper than just, oh, cultural diet. It's access to healthy foods. And so, and then, so checking your bias can make a huge difference in how, if that's your attitude, that it's your patient's fault, what kind of care are you giving your patient? Probably not the best care, because you're coming in from a biased perspective. And then also, just thinking about some of the other factors that I mentioned as well, like education, literacy. What are you doing to help your clients understand their body as a whole? So I feel like it's rare that we work with people who just have a communication disorder, like maybe like a fluency disorder or an articulation disorder. I would say that regardless of what setting you work in, the vast amount of your clients have a communication or a swallowing disorder that stems from some other larger disorder. So maybe they're neurodivergent, maybe the person is autistic. If you work with adults, maybe they've had a stroke, maybe they have underlying diabetes, maybe they have COPD. The list can go on and on and on. But are you just tunnel visioning to whatever the communication or dysphagia is? Are you helping them to understand their body as a whole? So, okay, this child is having meltdowns and they're not able to communicate that. But are we also talking about the sensory aspect? Are we making sure that this family understands that OT could also be a service that's available? Do they understand that autism is not a disorder that we fix, that it's a lifetime neurodivergence, that this is the child's identity? So just helping, you know, our clients and their families to have a better understanding of the body as a whole, and not just narrowing in on what we treat as SLPs. And also, sometimes that might even be advocating for other providers that work with the people that we work for. So, going above and beyond to help get referrals for a specialist or some other doctor, and maybe even helping your client's family come up with list of questions to ask and helping to lead them in the right direction. Those are all great things that we can do to help improve the health literacy of the people that we work with.
I appreciate how health literacy fed into health education. And so if I'm hearing you correctly, it's almost like the best way that we can boost health literacy for our patients is by taking an educational perspective on it.
Absolutely, because health literacy is the result of health education. So if
Mhm.
you have really good access to health education, then you're going to have greater health literacy. But if you don't have good access for all of these various reasons, for all of these social determinants of health, then you're going to have poor health literacy.
Thank you so, so, so much, Jackie. I mean, there are so many more questions I can ask you. Is there anything else that you just feel is dire on your heart, especially with this topic or the bilingual community, that you would like to share with the audience?
No, I think, my overall theme here is I think we should be intentional about the way that we're educating ourselves as speech language pathologists. And I hope that I've given some ideas for other areas to look into as you can continue to improve your knowledge so that you can give the best quality care to your clients.
Thank you so much, Jackie. I would love to have you on again, and I am definitely looking forward for this episode to get out so everyone can really change their practices. One thing I really want to say is, especially with the implicit bias piece, and a lot of us don't even know that we are perpetuating those biases. But really, when you were thinking about it, I just think about how once we even release the shame that we might be putting on the patients, like, oh, I mean, they just have poor diet, rather than thinking, oh, maybe they just don't have access to having a better diet. Um, our patients would even trust us because that's a lot of
Mhm.
disparities is the shame that we keep.
Absolutely.
Yes. So thank you so much. One final question for you, Jackie. What changes would you like to see done in the profession?
Just I would love to see more diversity. There's so many different forms of diversity that we could benefit from in this field, whether it's racial and ethnic diversity, having more SLPs that look like the people that we work with is really important. Linguistic diversity, so seeing more people from different language backgrounds and different dialect backgrounds and um, getting rid of the stigmas that we have towards people because of their language background. And then I think the most important one is more diversity of ability because we can't say that we're passionate about serving people with disabilities if we're not including them in our field.
Right. Right. And that is a whole other conversation. So we'll just have to talk about that at ASHA.
Yeah.
Well, Jackie, where can people contact you if they have any questions at all about your research and just want to get in contact with you?
Yeah, so the easiest way to find me is on Instagram. My Instagram is at unlearnwithme.theslp. My email address is bilingual SLPATL as in Atlanta at gmail.com. I also recently opened a Teachers Pay Teachers store, and I have a couple of items in there, and so it's also listed under Unlearn with Me, the SLP.
Okay, well, thank you so much. We didn't get to get into why or how you changed your Instagram name to unlearnwithme.theslp, but I'll have to ask the show. Well, thank y'all so much. Thank you, Jackie, again. Be sure to join us on Saturday, actually, when we meet with Jada. She is the founder of Beyond the Label, and she is going to help us talk about Caribbean population and cultural diverse treatment. Until then, thank you,
Thank you for
Jackie.
having me.